Many people believe that memory loss is just a natural part of aging, but that's not always the case. Hello everyone, I am Dr. Gupta, Associate Professor, Department of Neurology, AIIMS, New Delhi. Today, let's talk about Alzheimer's disease and clear some misconceptions surrounding it. Alzheimer's disease is the most common cause of memory loss and happens when abnormal proteins damage brain cells. This leads to symptoms like forgetfulness, difficulty with routine tasks, mental confusion, speech problems, and behavioral change, all grouped under a general term dementia. Such symptoms in older adults are often attributed to normal aging, retirement, life stresses, and strained relationships. It is important to emphasize that these factors cannot explain a major decline in mental ability. While occasional forgetfulness isn't alarming, persistent symptoms that affect daily life should prompt a doctor's visit. Alzheimer's is a progressive disease and worsens over time. In the early stages, it may cause mild forgetfulness, mood swings, anxiety, withdrawal, and difficulty making decisions. As it progresses, there is a loss of words, difficulty in navigation of familiar surroundings, and confusion regarding time and place, leading to a greater reliance on family. False beliefs and sleep issues at this stage can cause significant caregiver distress. In the later stages, individuals need round-the-clock assistance with feeding, movement, and personal care. Diagnosing Alzheimer's disease is a detailed process. There isn't a single test for it. Conditions like untreated depression, vitamin deficiencies, infections, or hormonal issues can cause similar symptoms and might be treatable if identified correctly. The diagnosis involves taking a detailed medical history, conducting tests for memory and thinking ability, doing brain imaging, blood tests, and using advanced methods like PET scans or spinal fluid analysis when needed. There is no cure for Alzheimer's disease as of today, but an early diagnosis can help slow progression and treat symptoms appropriately. Medications can improve functional abilities in the early stages. Doctors can create routines based on the patient's interests with activities like regular sleep, walk, music, and brain exercises to ease behavioral issues. An accurate diagnosis also reduces unnecessary tests, medications, and costs. Families can plan care in a way that reduces distress on a single person, either by dividing roles or hiring caregivers or using daycare services. While breakthroughs in medical research hold promise for future treatments and possibly a cure for Alzheimer's, prevention remains a critical focus. Risk factors fall into two categories. Those we cannot change, like age, the risk doubles every 5 years after 65, and genetic predisposition, especially in families where multiple members are affected at a young age. But there are a number of factors that we can change, like high blood pressure, diabetes, obesity, poor diet, inactive lifestyle, smoking, and excess alcohol use. Addressing these risk factors could prevent up to half of dementia cases. I would like to emphasize that small lifestyle changes made right from the middle age can have a great impact in the long run. Regular checkups for blood pressure, blood sugar, and cholesterol, staying physically and mentally active through exercises, reading, solving puzzles, learning new skills, eating a balanced diet, including whole grains, vegetables, fruits, nuts, and lean proteins, avoiding unhealthy fat, excess salt, free sugar, and addictions, enjoying leisure time through music, social connections, and mindfulness, and seeking early treatment for depression, hearing loss and vision loss can all protect brain health and reduce Alzheimer's risk. Remember, every step we take to understand and prevent Alzheimer's disease and support those affected by it is like planting a garden. Each effort, no matter how small, is a seed. With collective dedication, these seeds can bloom into vibrant flowers of hope and progress. So let us do what we can with what we have and where we are, for small steps can make a big difference. Thank you. Namaste.